like a Ferris wheel circling around, off in an open field, firm in the ground, lost in the wilderness, not to be found. Give me your hand and I won't let you down.
I've worked with a lot of people who want to change their lives. In some cases, they've tried and failed so many times that change starts to feel impossible. In other cases, it feels like you should be able to make the change on your own, but you put your best effort in and the change just doesn't happen. In my case, growing up with attention deficit problems, I knew I should be able to do all the things that were expected of me. I knew I was smart enough, but I put my best effort in and my mind just wouldn't cooperate with me. I couldn't make it all happen. When we have a mental or emotional problem, it's because our brain or our nervous system is stuck in some kind of unhealthy pattern. That pattern can be electrical or it can be chemical. Neurofeedback is simply a way of breaking up the old pattern and then replacing it or entraining some newer, healthier one. Treatment starts by introducing a stimulus to the brain through the scalp, which breaks up the old patterns and frees up the brain to create new ones. In some cases, that's all it takes. In other cases, we use the computer to provide operant conditioning, rewarding the brain when it does more of what we want it to do. On top of that, it's helpful to use other neurofeedback, biofeedback, or neurotherapy systems. I've used neurofeedback to treat symptoms of depression, anxiety, OCD. I generally combine trauma treatments like EMDR with neurofeedback to more fully and smoothly reduce symptoms of PTSD and even developmental traumas. It's probably most famous for what it can do for attention deficit disorder, which is how I found out about it. Though it ended up actually doing more for my sleep. I can now sleep all the way through the night. I've never been able to say that before. It's also very effective in treating addictions, head traumas, autism, and some learning disorders.